Welcome back to Takacs McGinnis Elder Care Law Hour. I'm Tim Takacs, and today we're talking about veterans benefits, who's eligible and how to get benefits.
And I'm Barbara McGinnis. In this segment, we're going to be wrapping up and talking with the guys from Operation Stand Down, our CEO, Mr. John Krenson, and immediate past president, attorney Bob Tuke. Welcome this morning, guys. Thank you for being here.
Thank you for having us.
Good morning. Sure.
Tell us just, what is Operation Stand Down? You guys do so many things. What do you want people to know?
We do. It's a great organization. One thing is that we've been around a long time. This year, in fact, is our 25th anniversary year. We're very excited about that. We've spent most of that term serving chronically homeless veterans, but more and more, and due to a great deal of Bob's leadership and vision, is we are working to prevent a new generation of veterans from becoming homeless in the first place. So we serve all veterans, and regardless of discharge characterization, we ensure they get resources that they're eligible for or that are available to them.
And it's real important to us that when a veteran walks into our facility at Edge Hill and 12th and in Clarksville, that when that veteran walks in and says, I have this problem, or I have this need, or I would love this kind of assistance, the answer that veteran's going to get is, yes, we will help. And a lot of times when you're a veteran and when you get out, you get a lot of no's, and that's just because of the way things are in society. So we are really focusing on the current needs, and thanks to John and his staff. So right now, probably the keenest personal need of most veterans is employment, and qualifications and resumes, maybe education, maybe GI Bill. We're a one-stop shop.
You know, I was thinking, just when you mentioned about that, I was thinking that oftentimes when you hear about veterans now, like in the newspaper, what do they put in front of that? Homeless?
Right.
I mean, that just seems, I mean, the sense of it is, it just seems like it's so prevalent out there. Is that really the typical client, or is that an exaggeration?
It's an exaggeration. I think today, the good news story that you don't hear enough about is that chronic homelessness among the veteran population, particularly in the Nashville and upper middle Tennessee area, is going down. General homelessness, unfortunately, is not, but among veterans, it's been going down. And we're able
so that's a story that's not necessarily being told.
That's right, that's right. But the good news then too is that gives us then more bandwidth to work with veterans to prevent that homelessness from beginning to occur. So a lot of the repositioning we've done in the last several years is to make sure veterans know that we're there not just for homeless veterans, but for all veterans. And the earlier we can engage with them in their transition to civilian life, then the smoother transition we can make for them, and they can actually go from a good starting point and on an upward trajectory. We talk about harnessing the value of a veteran service for the community. And so many times when you see homeless before a veteran, or you hear the PTS, all those things are real. But we begin to then think of all veterans as victims, and that's just simply not the case. Some veterans may be in a state of vulnerability, but all veterans have value from their service that benefits our community at large. And if we can give them that smooth start, then the benefits for society and civic organizations and across the board is just tremendous.
So from a county or community standpoint, what communities can Operation Stand Down help in? Just Davidson County, some Montgomery County, or all over?
So we're upper middle Tennessee is our active area. We are Operation Stand Down Tennessee, so we can work with veterans across the state. We have a vast network of resources. Bob mentioned one-stop shop, and that's the case. We don't seek to provide all services directly ourselves. That's not smart. But we make it our business to know who does what and who does what well. So if we don't do it, we know who does, and we work very collaboratively, very much in a collective way to refer veterans, to those resources that are out there. But where we can provide very direct services are in upper middle Tennessee. So we have a service center in Nashville at 12th Avenue and Edge Hill. That's our hub, if you will. We opened a satellite service center in Clarksville to be close to those veterans early in their transition. And we opened that 4 years ago. It's at 400 Madison Street in Clarksville, Tennessee. And then we do quite a bit of work in Rutherford County. We've put together what we call an engagement team. And these are veterans primarily from the post 9/11 era that go out to look for their peers. And so we spend a lot of time at different events and organizations down in Murfreesboro. I have a close relationship with the Daniel Center that Lieutenant General Keith Huber runs at MTSU with student veterans down there.
So it sounds like, because you were here for our 2 segments on the Tennessee Valley healthcare system. That's the VA.
That's right. That's right.
And that's like the healthcare and the services that. So you're you're obviously a different provider. Is that right? I mean, obviously, you're not providing healthcare services.
Right. So exactly, that is correct. And some of our programs are actually funded and are in coordination with the VA. Where we're different from the VA is that the VA works with all the federal benefits that are there. We work with them as one of our resources, but we're also there for all the other nonprofit resources that are out there for veterans, for the resources that are at the state level and the city level. So that's the unique thing about Operation Stand Down Tennessee, is we're really that hub, and we work with VA. We partner with Tennessee, we partner with Nashville and the other locations as well across the state.
So as a private 501c3 organization, we can connect with whoever we want to connect with.
Gotcha.
And our mission is to bring these kinds of things to veterans and empower veterans. And one thing that those of us who are veterans know and remember is when you're in the military, you have a second family, and that's the military.
Yeah.
And when you leave, all of a sudden that's gone. And so one of the things that veterans need is to find a way to replace that, to get re-engaged to the community. We love to tell people, you hire a veteran, you're hiring a leader. You can hire an employee from almost anywhere. You hire a veteran, you're going to hire a leader. And what we want to do is encourage that. That's why John mentioned, for example, General Hubert down at MTSU. They have a wonderful program down there for veterans. There are also the other major universities in Middle Tennessee have really good GI Bill kind of programs, but General Hubert is especially focused on this notion that hire a veteran, get a leader. And so this coming together of everyone is really interesting and caused the history of Operation Stand Down to just expand. And we're now part of something you've heard of, which is the local Veteran Service Center, the Middle Tennessee Serving Veterans, which was started as a number of different entities that serve veterans at the encouragement of the Washington, D.C. VA, I think in like 21 different communities, and we have a very active one here. And we're proud to be part of that, and we're kind of the, if you will, the hub of that. And so, the silos, as they say, have come down. We're coordinating with one another.
So if I'm a veteran and I'm watching this program and I'm going, okay, I need to connect with some of you. Do I need to fill out a form? Do I need to go to your office? Do I need to make a phone call? What's my first step? Yeah, so a term every veteran will understand, there are multiple avenues of approach to get to the objective of connecting with us. So there are a number of ways. One, we take walk-ins. Okay. So whether that's at 1125 12th Avenue South at the corner of Edge Hill or at 400 Madison Street. Yeah, and we're going to have your contact information up shortly. Yeah, so or they can call, and I think you'll have the phone numbers up there as well. Can also connect with us on Facebook. We've gotten very active on Facebook over the last year or so. And so Operation Stand Down Tennessee there, and that's just a great way. We take a lot of messages on Facebook and we respond then to those private messages that way as well. So search on Facebook for Operation Stand Down. Absolutely. Absolutely. And we also, if you click on the, I've forgotten what the exact title of it is now, but for the Metro website on services, Metro services, and there's a veteran hot link. Gotcha. And you'll come up on Operation Stand Down there. So so we're electronically connected, and of course with the younger veterans that's important. Okay, so we have less than a minute. What's the biggest challenge facing our veterans today? I think it's finding that connection back in the community, like Bob said. When you're in the military, you have a second family. So trying to find that network in the civilian world can be a bit of a challenge, but we're there, and that's when Stand Down. We see ourselves as a second family, as that battle buddy, that wingman, that shipmate. And once a veteran makes that connection and that engagement in the community, then it's all uphill from there. Yeah. Right.
Thank you, John. Thank you, Bob, for being here today and telling us about Operation Stand Down. We want to thank all of our guests for being here today and giving us good information. If you want to know more, check out our website. Until then, we'll be back next time with more information on Takacs McGinnis Elder Care Law Hour. Thanks.
Medicare annual